All right, welcome back. If you or a man you know has been struggling with erectile dysfunction, our next guest says he's here to say that it's time to feel like yourself again. Welcome back to the show, patient care advisor Bill Jeffries. Bill, thanks so much for being back with us.
Thanks for having me, Alex.
Nice to see you. So we're talking about a treatment that has no drugs, no needles, and no surgery. And some people might think it sounds too good to be true. So it's called acoustic wave therapy. Tell us how that can cure ED.
Well, I get that question a lot from people. They say, really? Sound waves? How's that going to fix my ED? And the science behind it is the acoustic waves will break up the blockages and the plaque that forms in blood vessels as we age, and it just restores the natural blood flow to those areas that need to be affected.
And they might have questions, is this safe if I have other medical conditions like diabetes or heart issues? What would you say to them?
It's actually a perfect treatment for a guy that has other medical issues that he's dealing with because of the fact that we don't use any drugs, so there's no drug interaction issues. And people that struggle with diabetes typically have poor circulation, and poor circulation can be a contributing factor to their ED issues, and we can fix that circulation problem.
Right. So, you know, it's a tough situation to deal with. How does a guy have that conversation with himself, especially with his doctor too, I imagine, and decide that this type of treatment is right for them?
Well, I would say to them that to get educated, talk to their doctor, obviously, talk to us. We have a doctor on staff that will educate them about their ED issues and what the possible avenues are that they can follow.
Now, do they need a referral from that doctor?
Definitely not.
Okay.
We have, as I said, a doctor on staff, and the process starts with a physical exam and a health history, and our doctor will make sure that the treatment is suitable for that patient and also recommend a treatment protocol.
And for many people watching and listening, this may be the first time they've heard of acoustic wave therapy. So talk about any studies that support its effectiveness.
Sure. There's been a number of studies done worldwide. It's been used effectively for about a decade around the world. It was just approved in the United States by the FDA in 2016 as a treatment for erectile dysfunction. But acoustic wave therapy has been around for a long time. It started as a treatment for like kidney stones, and then it's just kind of evolved, and we use obviously a different protocol and a different frequency of wave to treat ED. But there's been lots of studies. They're double-blind, evidence-based studies. The Urological Association called acoustic wave therapy the gold standard for ED treatment.
So it's supported by a lot of research and obviously great results. And there's no doubt, I mean, there's no getting past that there's a stigma around that conversation right now, but there doesn't have to be. How does someone get past that stigma and just start tackling the issue?
We do a lot to make a patient feel comfortable because there is a stigma involved, and guys don't like to talk about it, let alone come in for treatment.
Yeah.
But what they'll find when they come into our clinic, we have an all-male staff. The other thing is that unlike a general doctor's office that treats a variety of maladies, all we do is ED. That's what we do all day, every day. We've assembled the finest staff in Southern Arizona. We're professionals at what we do, and we work really hard to make patients just feel comfortable and open up and talk about their ED issues.
Right, and it's one step at a time, right? I mean, this doesn't get fixed overnight especially. I mean, it takes time and it takes compassionate people to care for you. So say someone goes into your office for the first time. What's that experience like? What's the very first thing that they can expect?
Well, they'll notice, as I said, it's a comfortable place to be because all we do is treat ED. That's our sole focus, and everything revolves around that. Our staff are all medical professionals with many, many years of experience, and we just work hard to make the patient feel comfortable.
Right, and so what advice, you know, for families, you know, people dealing with this, couples dealing with this, having a conversation between them? I mean, it's about honesty, right? You have to open up, you have to talk about it, because, you know, there's no better sanitizing than the sunlight, right? You have to talk about these situations.
That's right. Yeah, for couples that need to talk about this, and I often get that. We get calls from women that say, how do I approach my guy about this? This is a tough topic. And to them, I would say, realize that ED is a medical condition, just like any other malady or medical condition. Yeah. It's a condition that about 70 or 80% of guys are going to face sometime in their life. So if you find yourself in that situation, do the research, get educated, find out what ED is, what the causes are, what the potential cures are. Call and ask questions. We can certainly provide that education. Our website, flagstonemedical.com, has a whole bunch of information. And what I find is that if the other person says, you know, hey, can we talk about ED? Most guys will be uncomfortable at first, but then they'll be flattered that, oh gosh, you want to get us back to the intimacy we once had.
That's
and,
right.
And they'll actually be flattered by that.
And that's the key, is find yourself again. And that's what we're going to leave people with. Bill Jeffries, as always, thank you.
Thanks, Alex.
Nice to see you. All right, guys, right now there's a special offer. You can get $100 off your initial consultation if you mention the Morning Blend. If you want more info, visit flagstonemedical.com or call 520-600-4405. Don't go anywhere. We'll be right back.